Alright, we're going to try something a little different. We're uploading this video to YouTube, so it's a little easier for people in different areas to get to. And we're also posting it on the blog, takeokun.com, and the YouTube channel. So this is a little video for an article review. So this article just came out in the Journal of Ultrasound and Medicine, Detection of Free Intraperitoneal Fluid in Healthy Young Men. And this is the reference, Journal of Ultrasound and Medicine, 2012. It just came out, and there's the PubMed ID if you need to track it down. So what they did is, in the abstract, when you look, the conclusions say that these findings suggest that small volumes of pelvic free fluid in healthy men can be normal and don't necessarily indicate an underlying disorder. And they go further on to state in this conclusion that the role of the free fluid identification as an indicator of major intra-abdominal disorder should be viewed with caution. In the introduction, they also bring up that, this can also be applicable, perhaps, to the FAST exam in the setting of trauma. However, if you just read the abstract and the title, this can be a little misleading. This is one of the images that they show from the article, where they show that in grayscale, B mode, they're seeing the free fluid in the abdomen. This is between bowel loops. You can see it as indicated by the arrow on their image that there is an anechoic wedge, sharp angle, so it tells us that there's free fluid in there. However, this is in the right iliac fossa, and you can see this is very small. And I would point out that this is a linear probe that's opened up to a trapezoidal configuration, not a curved array. Here's another image where they show a little bit more free fluid, but once again, these are linear probes. These are higher frequency probes. On the bottom, you can see in what they call figure B, or 2B, is a grayscale sonogram, or ultrasound image of the right upper quadrant. It's a little shallow for my taste for a FAST, but they're showing that there's no free fluid in Morrison's pouch. In the right upper quadrant, they can see no detectable free fluid with a curved array probe. In the same person who in the linear probe, they can see wedges of free fluid in the abdomen, or in the pelvis rather. That being with the linear probe. So let's look at the study in a little more detail. These were 10 patients, 10 healthy males that they took after an overnight fast, ultrasounded, using a 12 or 7 megahertz linear array probe in the supine position in the right iliac fossa, looking for free fluid. So they saw small slivers in some and small geometric pools, or a little larger collection of free fluid. Then they let them eat, and postprandially they re-ultrasounded them. Once again with 7 or 12 megahertz linear array probes. These are very high frequency probes, shallow depth of field but very high resolution. This is very different than what we're doing a FAST exam with, and these are very small amounts of free fluid. So in their conclusion, they say that this physiologic fluid could potentially cause diagnostic confusion when scanning men for a diagnosis of intra-abdominal disorders after trauma or for appendicitis, in which a triangular cap of fluid is identified in the right iliac fossa. Once again, let me highlight that, the right iliac fossa, which is not one of the cardinal views in the FAST exam. And this is the right iliac fossa. They're looking for small amounts of fluid, slivers and small pools, small areas in between bowel loops. So nothing detected in the right upper quadrant. They're not finding huge amounts of fluids. And remember, this is with a linear array, a very high frequency, very well imaging probe. You are looking for very small amounts of fluid. And they go on to say in the article, and I give them credit, that they say this is not what you see in the FAST exam. So in the FAST exam, where you're seeing large amounts of fluid in the pelvis, large amounts of fluid in the right upper quadrant, left upper quadrant, this is not that case. These are people you're looking for bowel pathology on. Or if you do a FAST and you happen to notice a small amount of fluid in the right iliac fossa when you're scanning their abdomen with the linear probe, which generally doesn't happen in a FAST exam. So let me show you a couple examples of patients. So this patient had abdominal pain. Now, this is an appendicitis workup patient. Right lower quadrant pain and some other, factors. Maybe they have fever, etc., etc. But this is the view we had with the curved, with a C60 probe, a curved array probe, our general abdominal imaging probe that we would use to image for, say, the FAST exam on an adult. Now, I would point out that we are in resolution mode. We are on the higher frequency setting because we're doing a right lower quadrant scan looking for the appendix. And you don't really see a whole lot, right? You sort of like, well, I can see muscles. I can see some of the psoas muscle. I can see, bowel loops. I can see maybe what might be an appendix. Then we switch to the linear probe. And here, same patient with a linear probe, a L25 probe, a higher frequency probe, on general, and we can see that we can see the appendix very well, and we can see areas of free fluid around the appendix, these small geometric pools like they saw in the study. These were not visible at all with the curved array, but you can see them quite clearly with the linear, and that highlights the difference. Different probes at different frequencies and different resolution will show you different things. Here's a little clip of a different patient that we're scanning through the right lower quadrant. We can see the psoas, we can see some bowel loops, we can see the iliac vessels, and we see what looks like an appendix, possible appendicitis. So now we flip over to linear probe, same patient, and we can see the appendicitis, and we can see some free fluid next to the appendix, which you couldn't really appreciate very well on the curved array. And in case it's a little hard for you to pick out in the clip, here's a still image. Gains turned down a little bit, but here is the free fluid. That nice anechoic collection, sharp angles with those little wedging next to the appendix. So now, once again, I bring up that this is visible with the linear array because it's a higher frequency, greater resolution, not visible with the curved array. So while this study is interesting and applicable for us in the emergency department and acute care, this is more applicable for the patients where you're looking for abdominal pain from a setting of bowel pathology, where you're looking for appendicitis or similar bowel pathology, Crohn's, etc., but not for the FAST exam. This is not what you're going to see in trauma patients, because in the trauma patient, here you can see on the curved array, you can see large collections of free fluid in the pelvis. You can see these big anechoic wedges, sharp angles, very large collections. And it doesn't hold for when you're looking in the right upper quadrant, when you can see in this patient where you see a large amount of free fluid at the liver tip and in Morrison's pouch. This is not what the study was assessing. So applying this study to the FAST or the trauma patient is ill-advised. Number one, it was 10 patients. Number two, they were fasting. Number three, they were looking for very small collections that could only be visualized with the linear array probe. There are several examples here where we have shown you that using the curved array with a lower frequency, you may not be able to visualize these very tiny or minute amounts of fluid, but with the linear array you can. And so the study using a linear array probe looks at a very different population than the penetrating or blunt abdominal trauma that has free fluid on the FAST. So free fluid on the FAST exam with a curved array does not mean it's a physiologic amount in young men. Alright. And once again, if you want to subscribe, just click on the subscribe key and you'll subscribe to a YouTube channel, or you can follow us on Twitter @Takeo-kun or go to the blog. Thanks.